Eastside Psychiatric Hospital has been in business since 1987, and for most of those years it was a 24-bed unit right on Capitol Circle, easily accessible to Route 10 and to downtown Tallahassee, and it's an acute care psychiatric hospital, which means that folks come to us when they need acute services, and these can be folks with depression, these can be folks with anxiety disorders, this can be folks who are suffering from schizophrenia or bipolar disorders. So we'll treat the most severe clients. We'll also treat folks who are running into situations where they are at wit's end about how to proceed and have become a risk to themselves or others. Now, we were doing this business for a long time, and honestly, the physical plant that we were operating out of had some wear and tear. The other issue was that some things changed in terms of best practice for programming for folks in psychiatric hospitals. And, sort of an aside, I spent 20 years working online in psychiatric hospitals as a clinical psychologist, so I have some pretty strongly formed opinions about what good treatment is and what it's not. Well, 3 years ago, or actually it was a little longer ago than that, 4 or 5 years ago, we decided to really try and reformat what we were doing. So we completely rebuilt the Eastside Psychiatric Hospital. We tore the structure down to the studs, and we rebuilt it along state-of-the-art lines, so that now what we have in the facility that was opened in 2010, 3 years ago, are broad hallways, large comfortable lounge areas, a lot of space, a lot of light, and a lot of comfortable furniture so that folks can feel safe and folks can feel at home and folks can feel like they're not too boxed in, despite the fact that they're in a locked unit. At the same time, what we did is we started working on our treatment regimen and our treatment programming, and about 3 months ago unveiled an entirely new kind of treatment programming, which really represents for me the culmination of a lot of things I've thought about and seen and worked on for 27 years of my career. And this is a unit that's really focused on anxiety reduction. One of the things that happens with psychiatric symptoms is that when folks become symptomatic, when they're having a crisis, they might be feeling like hurting themselves or others. They might be feeling like killing themselves. They might be experiencing voices that aren't really there. They might be seeing things that aren't really there. And all of these are symptoms of ongoing psychiatric illnesses. Anxiety makes all of them worse. One of the problems with psychiatric hospitalization is that when people get hospitalized, they naturally become more anxious. They're in a locked facility, they haven't been in before, their time is no longer their own. It's a scary experience for a lot of people. Our aim in Eastside Psychiatric Hospital is to make this experience as not scary, as safe, as comfortable as we possibly can within the constraints of what we do. So we created new positions called patient care specialists. These are folks whose whole job is to run groups, to sit with clients and talk to them and to kind of provide what clients need. We have a new organizational structure which guarantees a lot of oversight and a lot of support, both clinical and administrative, on every shift. We have created relationships with local universities and local departments of psychology and social work, so that we have interns coming through the hospital pretty much every month of the year, and also bringing us information about the newest techniques that we incorporate into treatment regimen. As a matter of fact, much of our group program in the hospital was created based on the work of some